Hello everyone, my name is Tamila and our group is pleased to show you our presentation on the impact of the COVID-19 pandemic on Kazakhstan. So the first two cases of infection in Kazakhstan were confirmed by Yejan Bertanov on the 13th of March, and shortly thereafter President Kassym-Jomart Tokayev announced that all public events will be cancelled from the March 13. This decision led to significant changes in almost all spheres, and therefore, considering the response of the healthcare system, education, economy, and culture of Kazakhstan, as well as changes in mental health conditions of local residents, we examine the relationship between Kazakhstan and the multiple implications of the COVID-19 pandemic. So first of all, I want to analyze the response of Kazakhstan's healthcare to the outbreak of COVID-19, and I want to mentally divide the country's healthcare into 4 periods, which are strongly interconnected. The first period is pre-pandemic, and I would like to talk about it based on information from Atambekov's article. So our healthcare system was characterized by the transmission from the medical system of the Soviet Union, which lacked new technologies and methods of treatment. The introduction of scientific medicine into daily practice was rather slow, and along with this, there was a lack of training and epidemiology and biostatistics in medical training centers and educational institutions. All of these factors influenced the initial response of the health system to the spread of COVID-19. And like many countries, the first ways to avoid the spread of the virus was the introduction of quarantine, social isolation, and distancing. However, the underdevelopment of the pre-pandemic healthcare system was clearly manifested against the backdrop of the emergence of COVID-19. The wards were overcrowded, the ambulance did not answer calls, there was a lack of ventilation devices, medicine, and personal protective equipment. The virus was diagnosed mainly using RT, PCR tests, and computer tomography. But novelty of the COVID-19 virus made it much more difficult to detect. Thus, the Chinese embassy has issued a warning about a deadly unknown pneumonia circulating in Kazakhstan. This led to the fact that in Kazakhstan, they began to keep separate statistics on the incidence of pneumonia. However, the Kazakh Ministry of Health denied the news shortly thereafter. And for example, Dr. Michael Ryan, who was the one who suggested that these cases are in fact can be undiagnosed cases of COVID-19. This incident significantly distorted the true statistics on the incidence of COVID-19 in the country. So the next period is 2021-22, characterized by the stabilization of the situation, and you actually can see the stabilization from this graph. So according to Semyonova et al. In February 2021, there was an implementation of the free mass vaccination program. There were a lot of vaccines available: Sputnik V, Hayat-Vac, Sinovac, and the Kazakh developed Kaz-COVID-in vaccine. And according to Kazinform, the Ministry of Health also ensured access of the population to medical care and drug provision. However, a new problem has emerged, namely false vaccination certificates, which brings us back to the public health care problem. The reason for their appearance was that they were a necessary document in many institutions, but residents of Kazakhstan still did not want to have a vaccine. And there are various reasons for this: religious, personal beliefs, and others. Such behavior endangers not only the individuals themselves, but also the people around them. So in general, the situation with coronavirus or COVID-19 in Kazakhstan is rather volatile, and it is difficult to talk about the future with certainty. But a possible positive side of the situation is that the pandemic has pulled out all the shortcomings in the healthcare of Kazakhstan and set the path for its further development. However, even with the stabilization of the situation in the country, it is still difficult to answer the question of whether we are waiting for a new wave of the pandemic or vice versa, a victory over the disease. And as I already mentioned above, neglect of vaccination and precautionary measures can again provoke an increase in the incidence. And as Bloom, Smith, and Sanford stated, only through cooperative and collaborative measures we will be able to bring this difficult period to an end as soon as possible. And so now I want to give the floor to Artyom, who will tell you more about the educational sphere.
Hello, everyone. My name is Artyom Sergazinov, and this is my portion of the presentation of our group on the impact of the COVID-19 pandemic on the Republic of Kazakhstan. Now, my part is related to the education in our country and what exactly happened during the pandemic. Now, I'm going to start sharing my screen now, and I think since Zoom does not want to do two things simultaneously, my face will not be visible anymore once I start screen sharing. Okay, so I'm going to do education today. Now here on this slide, you can see two completely opposite situations. One in Kenya, you can see a student sitting in the photo in the bottom left corner, and in the top right corner, you can see an average public school in France. So what happened? In their book on the pandemic and the situation that was revolving around the world, and in particular in the chapter titled To Learn or Not to Learn, Michael Ryan, who is a professor on this course, Soc 3 to 5, and Serena Nanda, basically stated that governments made different decisions on whether to learn or not to learn. While Kenya, for instance, found taking an academic gap year throughout the whole country as a solution, France decided to keep schools open amidst the skyrocketing numbers of the infected. Now, these are completely different decisions. Kazakhstan, however, was somewhere in between these two extremes. The academic year continued in March 2020. There was a little spring break, and then the education resumed. However, every single student, be it a kindergarten learner or a PhD applicant, everyone was studying online from their home. However, what were the pre-pandemic conditions in the Republic of Kazakhstan? To be honest, not really good. Now, Nurmagomedov et al. In their source that was published in 2015 argue that with the emergence of small peasant farms and livestock farms in remote pastures where family groups are formed, children do not have opportunities to attend school. In such cases, it becomes a very complicated problem to provide people with even compulsory general secondary education. Now, you can't imagine if this situation was or had been before the pandemic, in which everything was quite ordinary, and some students were still not able to attend school. Whenever the pandemic struck, things became much worse. This photo displays exactly what happened in March 2020 and for almost a year after that. Students were studying at home using their devices, those that provided who did have the internet access. And here you can see on this young girl's laptop, you can see the homepage of the Kundelik website, which is basically a learning platform here in Kazakhstan, developed by the Ministry of Education. What was the impact? The education in the country did not stop. Although it went completely online, as I've said before, the reaction of learners was overall loyal and sympathetic. However, the quality of education delivered distantly was generally reported to be worse. At the same time, various reasons ranging from poor internet connection to lack of live interaction with peers behind the diminished quality of education have been reported. The emergence of the new normal in the education in Kazakhstan, and that was written in the source by Shilova in 2021. And here's the platform that I mentioned already, Kundelik. Every single school student was using that. And here at the at the bottom right corner, you can see a school teacher who is wearing a face mask and gloves. And this is what teachers had to do once the schools in Kazakhstan reopened. So what could be the post-pandemic conclusions for the Republic of Kazakhstan? Despite the emergence of negative aspects of the pandemic, the situation has been handled successfully. The necessary reforms into the educational system of the country have commenced, and the pandemic did help start that. The rapid development of possibilities for distance education has taken place. More people have acquired some sort of internet access. Schools became more flexible in terms of having the necessary equipment and access to the internet. Other problems at the same time, because of online distance education, have been exposed, signifying a much broader set of issues that need immediate attention, of course, but I think that happened to almost every single state in the world, and Kazakhstan was certainly not an exception.
Hello, and in this section, we will be discussing the state of mental health in Kazakhstan before and after the pandemic. I examined the readings that contain the data on mental health of particular groups, specifically healthcare workers, women, and students. Now, Kazakhstan was already in a sorry state when it comes to mental health. In some sense, it was in a full-fledged mental health crisis, especially among adolescents. Before stating the general trends, with regards to doctors, due to the stressful nature of their occupation, the stress that they experience at their workplace was much higher compared to other occupations because they have to work with people and not with objects. And because of that, globally, doctors experience more stress. And it is also true for Kazakhstan. The life of doctors are very stressful. Now, it was also found that women experience higher levels of stress and burnout rates compared to men. That's maybe due to the fact that they have to take responsibilities for caregiving and family responsibilities. There's a higher pressure for women to establish a work-family balance in order. It is true for many countries, and it is also true for Kazakhstan. No, it's not also true for Kazakhstan. It is especially true for Kazakhstan because the role of woman as a caregiver is very prevalent and doesn't seem to go away very soon, which is sad. But what's most shocking is that Kazakhstan is the leading country when it comes to suicide rates among adolescents. It was true ever since 2010s, and according to the reading, it remained true even in 2020s. There are many reasons, such as like social disadvantages, parental separation, school violence. But to be honest, I didn't find any particular reasons for why the suicide rates are so high in Kazakhstan. Nonetheless, the data on that is clear, and Kazakhstan is the leading country when it comes to adolescent suicide, which is also sad. Now, what happened after pandemic? As with all the things that COVID touches, the state of mental health in our country became even worse. That's largely due to the public stress and lockdown. Let's dive into the specific cases. In his reading, Simpson considers how it is important for students to socialize and hang out with friends. In some sense, that's one of the few things that makes students less prone to suicide because they have someone to talk to. But during the lockdown, friends were practically gone. And according to the reading, staying in contact in social media didn't help because, being friends with someone in real life is much different than chatting in social media. As a result, about a third of the students responded as having moderate to severe indications of a negative response to the situation. Many were scared and depressed. And that's really unfortunate. Nobody knows what the long-term effects will be, but we'll see in the future. As you may have expected, COVID-19 unequally impacted women's and men's mental health. What's interesting is that it's especially true for women with families. According to the reading, having a family for men is positively correlated with mental health, and whereas it is reversed for women. So if a woman has a family, she experiences more stress during the pandemic. To be honest, this was expected. The role of caregiver for women in our society had its impacts. And it is especially true in the times of COVID-19, where women could be nowhere but home. No wonder that their mental health was greatly exacerbated. Next, the doctors were more likely to resort to bad habits like smoking, drinking, and consuming high-calorie food. No one knows why, but male doctors were more likely to smoke, but that's maybe unimportant. Now, I think no one is surprised that mental health of doctors was so poor that they had to resort to smoking and other bad habits. That's no wonder, because doctors were the essential part for making sure that infected people receive a proper treatment. The stakes are high, and so the stress of the doctors because of it. Now, let's talk about something positive. Even though mental health was obviously exacerbated and no one knows what are the long-term consequences of that, we have something positive to say about Kazakhstan. In the sense, Kazakhstan almost immediately reacted with their measures after the first registered case of COVID-19. So, it's good, because the consequences related to mental health and other aspects would have been way worse if Kazakhstan didn't respond so quickly. So yeah, we have something positive to say about our country. Next one is Aruzhan, and she will talk about the culture.
Hello, my name is Aruzhan, and I'm going to cover the topic of culture and entertainment changes during COVID-19 pandemic in Kazakhstan. What happened to the entertainment during pandemics? To answer that question, I will discuss two subtopics of culture industry and daily survival of Kazakhstani citizens. But before I start, I would like to note that some people might think that it's not as important as the healthcare system changes, but as Ryan stated in the book of digital inequality, we do want to highlight the importance of the ability to find distraction, joy, and even indulgence as means of finding relief from the oppressive weight of pandemic times. So, culture industry. When the pandemic has started, the first thing that happened is holiday cancellations. Number celebrations in military parade for the 9th May were cancelled. And as well as that, quarantine and outdoor activity restrictions were introduced, and it was very harsh period for everyone. What did government do, and how do they respond to the pandemic situation? Creative industries, governmental creative industries were not so active in entertaining people because they were mostly focused on the healthcare systems and economic crisis, while non-governmental organizations tried to fix and stabilize the culture sphere of Kazakhstan. For example, on June 2020, UNESCO in Almaty organized Brazilian Art Digital Movement to provide a platform for an exchange of ideas and identify ways to support the culture sector and creative industries in Central Asia. Also, they had organized trainings within the framework in order to promote the common heritage on the Silk Roads. The next thing that should be discussed is public criticism on celebrating the July 6th festival. It is the day of Astana and at the same time the birthday of the first president of Kazakhstan, Nazarbayev. And even though the aim of those fireworks on that day were to cheer up people and to motivate that in the future everything is going to be good, people absolutely hated and they demonstrated their anger and criticism to that because they found those fireworks on the sky to be unethical because people were dying outside, and some families didn't see their relatives for some months, and governments spent millions for those fireworks. And the next thing that I will cover is that how daily life of people changed when the pandemic started. We will look at that by the social analysis through the consumer behavior during pandemic. Mostly, I will demonstrate the graphics. Changes in daily life activities has changed sharply, because before and after the governmental regulations, people's activities has changed. For example, use of social networks become more frequent than the social activities with friends. Hobbies has changed as well, because the use of movies and music streaming services and playing computer games became more important, and people use that mostly all the time. While the fitness workouts became less popular due to restrictions and general decrease of motivation to go outside and to do something for your health. Furthermore, food delivery is crucial topic because it was not important and popular before pandemic. As we can see on the graph, there was a high peak of popularity of Glovo, Yandex delivery services. And this also shows that people not only were living daily life at home, but also eating, and they started mostly to rely on food delivery rather than cooking at home. So that's the general changes in the entertainment and daily survival of people during pandemic. Overall, the conclusion of the pandemic situation is that the quick and proper government response, along with the fast arrival of vaccines, have made this unprecedented experience much smoother than it otherwise might have been. And we give the positive conclusion to all the situation, although the country did have a few problems that emerged as a result of COVID virus. The situation overall has stabilized.